Okay, if I could have everyone's attention, please. Smiles, come on, not so glum. One of the things I tell people that we're really fortunate about here in Columbus is we've got a lot to work with. And we're going to see that today on display. Can you hear me in the back? No? There we are. Okay. So we've got to get a little closer to this microphone. Well, what I began by saying was that we're really fortunate in Columbus because, as I tell people often, we have a lot to work with. And I think you'll see that on display here today. Get the rest of my notes. Our COVID or our coronavirus task force met this morning. And from that meeting, we made a few decisions. We've got a few recommendations, and we'll have the opportunity to share those with you later on, throughout this discussion. A couple things to keep in mind. As I said, we've got a couple of decisions that we made, and we have a few recommendations. So as you listen to what we say, it is important to understand whether you are listening to a decision, something we're going to do, or a recommendation, something we would like for others to follow. Make sure we get that nuance clear. Part of what we're trying to do as we work through this is to learn a little bit from the experiences that others have already had, in particular out in Washington State, and try to implement some of the lessons that they bring to us. What we're going to try to do here is to implement things they wish they had done 3 to 4 weeks ago. We're trying to we're a little bit behind them, so to speak, in terms of the prevalence of the virus in our community, and so we want to react proactively. I guess I should say we act proactively and try to get ahead of this before we're faced with the situations that they've had. We will have this decision that we'll announce, or Jim Roberts will announce with respect to the schools. We've got a city decision that we want to announce, a group recommendation, and then we'll present, or Jim Bickle will present the Columbus Regional Health plans for how they intend to respond to the community health situation that we have. As I said, we'll leave the school decision to Jim Roberts to announce. For the city decision, and I should say, on your way out, there'll be a press release. It's on the table back there with the little on the doorway on the way out. But basically, we're going to close all city facilities for meetings through April 6th. Now, there'll be some pre-existing or some already scheduled meetings that will occur, but in general, we will close the commons, the playground at the commons, not the restaurants. We will close Donner Center, not the administrative offices, but the meeting facilities. Same thing or similar answer with respect to Hamilton and a few other facilities around here. The details will be in the press release, but if anybody has any questions, they're welcome to call either the Parks Department or they can call my office. There'll be a group recommendation with respect to any other kind of community gathering. Now, we talked at length about faith-based community gatherings, church services. And part of our concern about church services isn't only the number of people, but it's the constituency. Part of what we're being told is that the population that is most at risk is those over 60 and those with underlying health conditions. And it's just our belief, our intuition, that church populations tend to be overrepresented in those groups, or those groups tend to be overrepresented on Sunday at church. And so we have concerns about how the coronavirus might be spread among that subpopulation. And so we have asked any community group that would have a meeting that would exceed 250 to please consider rescheduling or canceling the meeting, and in particular want to address that towards the faith-based communities. But again, that's a recommendation. The community's task force will continue to meet as needed. Our next regularly scheduled meeting is March 27th. And again, that's 2 weeks from today, and we'll have plenty of conversations, I'm sure, between now and then. But my point behind March 27th is that's when we will re-review the decisions that we just made, or just announced. I don't know yet whether we will be expected to continue the closures that I've mentioned, but we'll review that and make a decision or announce a decision on March 27th. Again, before I move on, I want to introduce a few people, but I want to thank not only the folks who are up here, but I also want to thank all those from City Hall and from CRH and the school system who have been helpful in trying to help us put together our response to this pandemic. From my right to my left, we have Jim Bickle, who's the President and Chief Executive Officer of Columbus Regional Health. We have Dr. Jim Roberts, Superintendent of Bartholomew Consolidated Schools. Brian Dabalski, whose title is Bartholomew County Public Health Officer. Got it? Got it. It's a long one. We have Dr. Tom Sonderman, who's Vice President with the hospital. Dr. Slade, help me again? Crowder at Columbus Regional Health. And Carl Lennep, Bartholomew County Commissioner. Next, we'd like to hear from Dr. Dabalski. Thank you.
Thanks, Mayor Lennep. So some of this, what I'm going to talk about, is kind of piggybacking on what the mayor already mentioned. But today, after some careful deliberation, our coalition decided that it is necessary and time to put proactive measures in place to hopefully reduce local spread of COVID-19. Now, I do want to stress that as of right now to date, there are still no local confirmed cases, but this is why we're acting at this point in time so we can get ahead of the curve. So what are these proactive measures? Mainly, we're going to recommend avoiding large gatherings. The governor came out yesterday and said to try to avoid gatherings of 250 or more people. So that's also what we're going to go with locally. Following social distancing recommendations. So if you're in a group in the public, try to stay 6 feet away if you can from the person next to you, especially if you don't know them. This disease is primarily spread by respiratory droplets, so coughing, sneezing, or sometimes just spittle from the mouth can get into your mouth or nose and spread this virus. And of course, the most important thing we want to still stress, practicing good hygiene. If you're out in the public, especially if you're going out to a restaurant, go in, wash your hands before you eat, wash your hands after you eat. If you're going to be touching the table, make sure that you've got something that you're using, some type of sanitizing agent where you're wiping that off. And also, if you're at home or if you work in an office, frequently clean commonly touched areas such as doorknobs or toilets or sinks or countertops. So I do want to stress this decision was not an easy one, and really this isn't intended to incite any type of panic, but also to just reinforce that we need to act now and be proactive and show some prevention. I'd also like to, as the mayor said, encourage the elderly and individuals with chronic health problems such as diabetes, COPD, heart disease, to think twice about going out in public, especially larger gatherings. Maybe have family members go to the store, bring you food so you don't have to possibly go out and be exposed if it is in our community. Anyone with symptoms suggestive of COVID-19, such as fever, cough, or shortness of breath, should contact their physician's office or the local resource call center that I think Jim will probably talk about here shortly. And also, due to this ever-changing information associated with COVID-19, things are going to be changing daily. So if you want a resource, please go to isdh.org or cdc.org for that information. Next, Dr. Roberts.
Well, good afternoon, everybody. Thank you for being here this afternoon on pretty short notice, I think, in terms of us getting organized and getting this information out to you. I also like to make sure and thank the panel members alongside me, as well as anybody else who's been able to attend these meetings that we've been having to figure out the stuff that's going on and make some really important decisions. So thanks to all. The mayor indicated how special this place is as he began his remarks, and how blessed we are to have the resources available to us to have these important dialogues. So I especially appreciate it because we have tough decisions to make, and I'll announce that. But as we get through those discussions, I did make it clear this morning in our conversation that although I have a doctorate, it's in education, not medicine. So I need help from the medicine people, those who have expertise in that area, which did remind me when I first got my doctorate, I had a child or a student ask me, are you a real doctor? So I'm still trying to figure out what that means. So we are making decisions that impact a lot of people. And in our school corporation, we are talking about nearly 12,000 students, 2,000 employees, and then everybody else that is associated with those individuals. So we do understand the ramifications. But after a lot of conversation this morning, we are going to close BCSC on our return to spring break. So we are still out next week for spring break. Upon the supposed return of Monday, March the 23rd, we will not have students coming back to the buildings, but instead have e-learning days. So we will still try to keep academic engagement going and do so through our e-learning efforts, which is just an alternative way for us to have school. And then we will be closed and doing or utilizing e-learning days for 2 weeks. So that will take us through Friday, April the, what is that, the 3rd? Friday, April the 3rd, so returning at least at this point in time. And as the mayor indicated, we're getting back together in a couple of weeks just to evaluate everything in terms of where we are as a community and as a school corporation. So at this point in time, we'll be looking to return on April the 6th. But it is important to note again just the ever-changing nature of this situation. So the governor has given school corporations some latitude, 20 waiver days, for example. So as you hear about other school corporations perhaps closing, they may or may not be taking advantage of those waiver days right now. But if my quick calculation, we have about 50 days left until the end of the school year. And so we are going to start off utilizing, again, the capacity we have from an e-learning standpoint. Devices did go home with students on Wednesday, preparing for this possibility. We will have further details by Wednesday of next week, just in case somehow a device didn't get home, other information in terms of what that e-learning day will look like, and then even some additional specific information for our staff. Sometimes in a case like this, support staff in particular will have a lot of questions because those are hourly employees. They're relying on being able to work on an hourly basis. And so we do have many options and opportunities available for our support staff members to engage in work to help us get through those e-learning days and to ensure they get paid over that period of time. And again, we'll be sending specific information out to our employees in regards to that. But the big announcement from our school corporation standpoint is, again, we will not have students return to school on Monday, March the 23rd. We will be conducting e-learning days for 2 weeks. An additional statement would be that all of our activities are stopped, practices, events, anything else that is tied to our school corporation beginning on Monday. So spring sports season, for example, is starting. I know practices are beginning and people are trying to get out and get going, but we are putting a halt to that. So no school activities at all beginning on Monday, and then especially true with no school beginning March the 23rd, e-learning days. Thank you. And we do have Mr. Jim Bickle from Columbus Regional Health next. Thank you.
Thank you, Dr. Roberts. Good afternoon. As you've heard from those that spoke previous to me here, this is an ever-evolving situation. And we are actively working to how we can best isolate and contain as much as we can the impact of COVID-19, the coronavirus. Well, let you know, CRH has been actively preparing our healthcare delivery system over the last few weeks in preparation and response to COVID-19. We've been modifying our operations across the system. This includes our main hospital inpatient facility, our outpatient services, emergency and urgent care services, as well as our physician offices. For example, you may be aware we have recently implemented visitor restrictions at the main campus, limiting the entrances, performing screening activities. As folks enter into our main campus facility, we look for those sort of practices to further expand to other sites eventually across our health system. These types of operational changes and modifications are first and foremost with the goal in mind to keep our patients, our healthcare professionals and staff, and our community safe. Our main message right now is anyone who is concerned that they may have COVID-19 or have been exposed in some way should call the CRH COVID-19 Triage Resource Care Center. Number on that is 812-379-4449. That number is on our website, but that would be your initial step. This would allow you to, over the phone, talk with our trained staff to best advise you on the proper care. Again, reinforce the message, call the COVID-19 Triage Resource Call Center for our trained staff to help you figure out what is the appropriate care and next steps for you if you feel like you've been exposed or think you have COVID-19. Our CRH team is continually monitoring national, state, and local developments. As said before, this situation is evolving and can change rapidly, hence impacting how we may have to continually evolve and change our operations and services as the situation would dictate. So the end of my comments. I believe we're going to open it up for potential questions.
Exactly, yeah. Yeah, at this point, that's the end of our prepared remarks, unless somebody has something else they just want to offer. So, media. Julie?
As far as City Hall and meetings, can you kind of explain how City Hall will operate? I know the buildings that you're closing are the ones that are readily accessible to the public all the time, but will City Hall still be accessible?
Yeah, the question relates to accessibility here at City Hall, and I think us elsewhere. I mean, administrative offices will continue to be open. So if you have work with or business to conduct with the planning department or the engineering department, those departments will still be open. The mayor's office will be open, and so on. We would ask that if you can conduct your business over the phone, that you do so. But the administrative offices will be here, as they will be at the Parks Department, Department of Public Works, and so on.
And if there is a case that has a positive test result in Bartholomew County, how will that be communicated to the media?
So first, we would have to get that confirmation from the state, which would then relay that to the local health department, which I would be the spokesperson for that. So I would be more than happy to communicate that information onto you.
Will that be something that you would communicate to the community without us asking for it? It would just be something that you would release as far as?
Yes.
John?
I know there haven't been a whole lot of tests statewide. I think over 70 some odd this morning. Have we done any tests of anyone in Bartholomew County?
At Columbus Regional, we've done at least 2, to my knowledge.
And those obviously were both negative, or is there an incubation period you have to wait for?
Right, there's generally a 3-day turnaround on the tests that go to some of the lab providers.
So those people are encouraged to stay at home and quarantine for the.
Do we have the results of those 2 tests back already?
There, yeah, the no confirmed tests, are cases in our county right now.
No confirmed positive.
Okay.
Yes, ma'am?
I know that for some people, internet access is an issue for some students. Is there going to be anything set up for students who don't have access to internet at home?
Yeah, so good question, Julie. It's something that we, as part of our details coming out next week, we will provide more information. What we're looking at is at least some sites that we can have people come to. We have sites within the community that are identified on our website, but some of those may not be available now with some of the other provisions we put into place. So we need to double check with each of those locations that are public, and based upon that, perhaps open a mental health day cafeteria, something like that, to allow, and again, proper spacing, all those other precautions we would have to take, but trying to figure out if we would have to use one of our buildings, what that might look like. But just an extra piece, going to Julie's question, with our e-learning opportunities, our website, bcscschools.org, does have an e-learning page. So that's a lot of information in terms of just the resources we have out there, including locations that might have internet access for those who don't. That's currently available.
And also for Dr. Blonsky, we're getting a lot of calls, people saying that the media is overplaying this and overblowing this and making too big of a deal about it. Do you have a comment just on how serious this group feels this issue is right now? So we can kind of explain to the public why we are covering it the way we are.
I think the main reason that we're doing this and we formed this coalition is so that we don't have a situation like which is occurring in the state of Washington right now. So this is a potentially serious illness. I mean, it can definitely be deadly. It is more deadly than influenza from what we've seen. Now, obviously, it's primarily affecting people over the age of 60 and people with the chronic health conditions, but as with the flu, we suspect that this could be deadly in any age patient.
And right now at the hospital, are you a little bit inundated with calls and things like that to the call center yet, or the?
We've certainly seen a significant increase in calls to our emergency department, our physician offices, other contacts within Columbus Regional Health, which is why we put the resource line in place as it relates specifically to COVID-19. Likewise, kind of building on Dr. Nabalski's comments, the more we can keep people a bit isolated from that, so just showing up in a physician office or the emergency department unannounced, thinking you may have COVID-19, knowing that you may be coming in because of this, or maybe you're coming with something else and may have this, it's really helpful for us to know so that we can treat it appropriately without putting other patients, visitors, and our staff at risk if they're not wearing the personal protection equipment that's required to deal with folks that may be suffering or infected with COVID-19. So that's really why we want folks to call that number, and we can provide the consistent direction to do that for all of our sake. We're trying to deal with this.
Excuse me, did you say there's been an increase in ER visits or calls?
No, just calls, people calling, what should I do? This is what I'm experiencing, what should I do? Should I come in? And not necessarily visits related to that, but we've seen increased inquiry into what to do, which is why we put that line in place.
Okay.
I'll go ahead and jump.
Mayor, I'm sorry, I may be a little bit confused. The essential government meetings, the redevelopment commission had an agenda come out, city council had an agenda come out for next week, Board of Works, I'm assuming is meeting. What is not meeting? And are you going to be canceling those meetings? And is there any provision to hold those meetings remotely?
There's no provision to hold them remotely. My understanding of Indiana law requires physical presence by the decision maker, so we either all get together in the same room or we don't meet. At this point, we intend to keep the meeting scheduled, the meetings as scheduled. To the extent that we can minimize the agendas or even cancel a meeting, we'll do that, but I'm not aware that we've been able to find a meeting yet that we can cancel.
So meetings that other groups would use in City Hall or at Fair Oaks, those are the meetings that would not be held?
Say that again?
Organizations that would normally meet in City Hall or are meeting at Fair Oaks, are those the meetings that will not be held? Are those the ones that are going to be canceled? I don't know, am I asking that backwards?
I think I'm having a hard time following the question, Mary.
I can interject, John. So what, like, the Calhoun meeting room, we will take that out of commission. So yes, we have groups that will come in here for a meeting or a dinner or a lunch. So they will be asked to cancel, just like we're canceling at the Commons. And Fair Oaks along the same line. Fortunately, as you know, we had an elevator out for a while. It's back in service, so we've moved the normal Board of Works and City Council meetings back here. As the mayor said, those will continue. But if we have a group that's coming in to use this space that we're using, we will reschedule them.
So would it be safe to say that essential government meetings will still be held, but public access to government facilities for meetings would not be available?
Yes.
Okay.
Okay, I got it. Sorry. Sometimes a little slow.
I wasn't
yeah,
sure which
but-
one was being canceled if all the meetings were being held, so I was
Yeah.
lost.
The regular public meetings that, because, you know, the good news, bad news is, if we want to pay our bills, Board of Works has to meet and approve the claims. So, you know, we're going to pay our bills. We got to pay our payroll, you know, that kind of stuff. So there's just some basic elemental functions of government that have to continue and that have to be done in a public meeting, and that requires physical presence of the decision makers. So we're kind of backed into, you know, having to have those meetings. To the extent that the public is still invited, but we're encouraged to watch at home on the, you know, on the live stream. So yeah.
Same thing's true of county government. We will continue to meet as well on our Monday mornings, because again, we have to approve claims and payroll. And if this situation changes, we and city government, I would assume, would probably act together on any changes of that decision.
Right.
Carl, on the same note, is the county going to give is it removing access for any other groups that don't come in and use county facilities?
I think likewise, I could sit here and say, I'm thinking of a couple of activities that have already been brought to my attention. And those groups are $250, but the Dan Burbrink Scholarship Dinner at the Fairgrounds would be recommended probably to not meet. The Lincoln Day Dinner, I think, is scheduled the last week of March. I would think that it would be recommended not to meet. That 250 number is maybe a little hazy.
Yeah, well, you know, the 250 number came from the governor, and we're not sure where he got it, right? Not to cast any aspersions, but what I would hope that people would do would be a valid self-assessment. I mean, if you have any of the risk characteristics that they talk about, you're over 60, you know, or you have any underlying health conditions, you know, tell yourself what to do. And that's going to be one of our best bulwarks against the spread of this disease. Yes, ma'am.
I see Cindy's in the front row, but are there any recommendations for businesses? We have some very large manufacturing facilities with large numbers of people who are working
Care to take that
together.
one?
Is Jason here too?
Yeah,
Jason's
right back
here
there.
too. We are sharing resources. We find that larger companies tend to have like business disruption strategies. I'm concerned especially about the small businesses, locally owned businesses, because they're especially vulnerable, and they don't often have the resources that some of the larger companies have. Tom's here in the room. So yes, we are sharing resources with them on how to protect themselves.
You haven't heard of anyone potentially closing down or?
No, but they are looking for strategies to tell their story. I mean, you think about small restaurants and retailers, you know, if people are healthy and ready to go out in a small group in an appropriate way with all the hand washing, we would hope that people would continue to frequent those businesses. We want them to survive. So I would just ask the public to be mindful of the kind of restrictions we're talking about. Maybe it's ordering a carry-out meal or having it delivered. So we're certainly looking out for our business community.
John.
I realize this isn't necessarily in the government's bailiwick, but I'm wondering if there's been any discussion about this. I understand that a lot of retailers are out of a lot of items that people are hoarding. If we get to a situation where you can't buy hand sanitizer in the city of Columbus, where you can't buy toilet paper, which I understand we may very close to be there right now, is there any indication from any government agency or any not-for-profit group that will help fill some of those holes for people who are just unable to buy those essential items?
I'm not aware of any, we've not had any discussions with the retailers about inventory items. So no answer for your question.
Jim, I'd like to be bold enough to say that this task force this morning, while it had government, or it had private business representation, we in county government have always taken it very seriously, and I'm going to use the example of calling a snow emergency. which, you know, a snow emergency at a certain level is supposed to restrict all travel, which would cripple industry. And we have always felt like that's a very serious action to take. So I would like to go on record to say that as of this morning, this task force did not make those kind of recommendations to business, correct, Jim?
Yeah. Julie?
One more, Dr. Roberts. I know that with the number of children who are on free and reduced lunch, and there are a lot of kids whose main meal of the day is a school lunch, are there going to be any opportunities for these kids to perhaps be able to make sure that the kids are fed even while they're learning at home?
There will be, Julie. Thank you for asking that question. I should have mentioned it in my comments. So we will have meals available during the days that we're in service. So those 2 weeks, 10 days, we're looking at a couple different options as to what that looks like, whether it is sites that people can come to or us getting them out to people in a variety of ways. It might be a way to even use our bus drivers a little bit because they're not bringing students in. How else can we use different people in different ways over that 2 week period of time? So getting creative a little bit, but there will be little service for our kids.
Well, thank you all very much. My understanding is that President Trump has remarks to make at 3 o'clock. I didn't check my phone. We're right at 3, so we're adjourned. Thank you all very much.